This is Peter Lansberg from the ESC in Rome, and I've been asked to discuss the ODYSSEY ESCAPE study conducted in patients with heterozygous familial hypercholesterlaemia. It's a special group of hypercholesteremia patients because they have been treated with LDL apheresis. So these were patients who had either very high LDL cholesterol levels or they didn't respond or didn't tolerate statins. The study was conducted in Germany and in the US. In Germany, LDL apheresis is considered to be a more or less standard treatment for homozygous and some heterozygous patients. And in the US, there is also a large group of patients being treated with this procedure. Now, just to illustrate a little bit the context of LDL apheresis, it's a procedure more or less comparable with dialysis. So on average, patients have to come into a clinic for a one-day procedure, and that's usually done once a week or sometimes every 2 weeks. The LDL goes down dramatically after the procedure, sometimes more than 70%, and during the week or two weeks follow-up, it goes back again to almost the normal levels. What they do is they calculate more or less the area under the curve of LDL cholesterol exposure, because the LDL goes up, and then that should be at least 30%. So if the amount of LDL cholesterol during the period between apheresis is reduced by 30%, then it's considered to be a successful procedure. What the investigators wanted to check is if the new treatment with PCSK9 antibodies in these patients could avoid or maybe reduce the number of LDL apheresis procedure. Realize that this is an expensive procedure, roughly 50 to 60,000 euros per year if you do it weekly. Now, PCSK9 antibodies in Europe on average are 5,000 to 6,000 euros per year. So you can imagine if the amount of procedures can be reduced, that would have a significant impact on the cost. Design of the study was as such that there were in total 62 patients that were included. 42 were in the alirocumab arm and 21 were in the placebo arm. Now, when the trial started, the first 6 weeks, all the patients continued with their normal LDL apheresis frequency. So for some once a week, for some twice a week. After 6 weeks, the patients were evaluated for their LDL cholesterol lowering, and if that was more than 30%, then the procedure would be skipped. So with alirocumab, the LDL lowering is much more stable. So once you get a sort of plateau level, your LDL more or less stays on that level. So if it's more than 30%, that would account at least for the 30% average LDL reduction. Primary endpoint, as said earlier, was the amount of LDL apheresis procedures avoided. The end of the study, which was 18 weeks, 75% of the procedures could be avoided, which is, I think, a very attractive number, if you look at the price that you pay for the LDL apheresis procedure. So, for instance, if you have 10 patients for 10 weeks, you could avoid, and that's 100 procedures, you could avoid 75 of these procedures, roughly at about 1,000 to 1,200 euro per procedure. If you look more specifically, then out of the 41 patients that were allocated to alirocumab, 26 didn't need LDL apheresis at all anymore. And in total, 38 out of 41 had at least a 50% reduction of the amount of procedures. If you looked at the LDL cholesterol level, then in the ones that continued with their standard LDL apheresis, LDL was roughly around 4 to 5 millimoles. If you looked at the ones with alirocumab, that was reduced to approximately 2 millimoles. So also from that respect, there was a nice reduction of cholesterol levels. One point I have to clarify. First of all, the type of patients within the American and in the German group was slightly different. In the US, most of the patients had LDL apheresis every 2 weeks. In Germany, standard almost every 1 week. And also in the German cohort, more patients were on statins. In the American cohort, there were more reported side effects on statins and less patients were using statins. Second important point is, of course, the cost saving associated with reducing the amount of procedures. But that's also based on the fact that in the US there is no designated target for LDL cholesterol. So that's why they chose to use the 30% difference between pre and post. However, if you still aim for what we call the European target of LDL cholesterol, that would mean that your LDL target would have to be below 1.7 in these high-risk individual patients. So then you would end up having patients using LDL apheresis plus alirocumab. So the cost saving depends a little bit on the strategy of how you implement the outcome of this study, where you say, we're satisfied with having the nice additional reduction and no LDL apheresis treatment is needed anymore, or if you say, no, we try to achieve actual targets which were impossible with only LDL apheresis, and that's now possible by using a combination treatment where you can get these patients with an LDL below 1.7. So I think it's an interesting study in the context of countries where LDL apheresis is used frequently, like in Germany or Italy and in some parts of the US. It might have some real impact on how these patients are treated. In countries where there is no LDL apheresis, of course, a different situation where these type of patients standard probably will be treated with PCSK9 antibodies, and I think we can expect that at least a larger number of these patients will be treated adequately, although additional treatment might still be an issue in some of these very high cholesterol level FH patients.